Well, greetings everyone on this chilly December day for some and very snowy for some others I hear in the Alaska part of the world. Welcome to this week's It's Worth a Shot edition. Today is December 14th, 2022, and today we have two wonderful guest speakers on tap for you. We will be discussing antibiotic stewardship, a little twist as we talk about urine cultures and antibiotics, as well as a Mountain Pacific tool that was developed to track some COVID-19 data for your facility. We'll be doing a live demo of that. Next slide, please. Little reminder or announcement, I guess you could say. Please know that on December 28th, we will pause our weekly open office clinician hours time for you on that Wednesday, just to recognize holiday and all the hard work that you do and wish everyone the best of the new year and holiday season. So again, announcement, we will pause the December 28th session of our Worth a Shot weekly series. And I'll send out a flyer to remind everyone. So you will notice that that date will not be on your calendar. Next slide, please. As always, let us know if you have any topic ideas or anything that we can address, and we will gladly research it. And we have a polling question today. All right, are you offering any incentives for staff to be up to date with their vaccines? Yes or no? Early on, there was quite a few incentives. I heard of a corporation giving away a trip to Hawaii and a new car. I did not hear the winners, but I did see their posters for the contest. Give everyone a few moments to answer that. Again, are you offering any incentives for staff to be up to date with their vaccines? Yes or no? All right, thank you, Mary. I think we can close that poll. Looks like most folks responded no. All right, next slide, please. All right, so our weekly snapshot of influenza, it looks like, knock on wood, we're a little stable from this week to last week. However, we still are significantly higher this time than last year, and also record highs as compared to a reflection to previous years. Seasonal influenza activity is high across the country, and they're continuing to detect mostly influenza A viruses, but also continuing to say that there's a good match against this year's vaccine. There was 7 additional deaths, pediatric deaths that is, this last reporting period. So there's now a total, unfortunately and sadly, of 21 pediatric flu deaths reported this flu season. Let's see, all viruses collected and evaluated this season also have been susceptible to the influenza antivirals. However, as noted previously, we are seeing a shortage on some of those antivirals, so please work closely with your pharmacy and providers for alternatives. And as a reminder, annual flu vaccine is the best way to protect against flu, and vaccination helps prevent infection and can also prevent serious outcomes in people who get vaccinated but still get sick with the flu. Next slide, please. So we also snuck in a little snapshot and update on COVID-19. We are seeing an uptick in cases as well as deaths. However, there's a little bit of movement downward in hospitalizations. So continuing to encourage vaccinations, especially as we enter holiday season, and kind of a reminder to take those important steps to protect yourself and others from serious illness as we look at those holiday gatherings. And remember to test if you feel like you have symptoms, and talk to your provider and take those steps to treat. All right, next slide, please. So without further hesitation, I would like to introduce one of our in-house pharmacists, as well as a clinical data scientist with Mountain Pacific Quality Health, Stevie Tsai, who's going to be sharing with us urine culture stewardship and antibiotics. The floor is yours, Stevie. Thank you.
Thanks, Jessie. I appreciate that introduction, and hope everyone was watching that influenza and COVID update. The triple pandemic is real this year, unfortunately, and we all have to be mindful of it. And that vaccine stewardship falls in line well, I think, with stewardship of other medications. And so we're just going to take a brief moment today to talk about urine culture stewardship and asymptomatic bacteriuria and antibiotics. Next slide, please. So when we start talking about the different things that can happen in some of our elderly populations and those people who live in long-term care facilities and skilled nursing facilities, one of the things we have to continue to be aware of is this prevalence of asymptomatic bacteriuria. And this is a place where clinical practice has really dramatically changed over the last decade and a half. It used to be that when we had a resident who had a positive UA and we saw bacteria in there, we treated it. And it turns out for about 3 patients for every 10 we treated with antibiotics, we caused some sort of adverse event in 3 of those 10 patients and saw no benefit in all 10 of those patients. So after lots of good research was done, many good scientists came to the conclusion that a huge percentage of our adult population carries bacteria all the time. We tend to think of the bladder and the urethra as sterile environments, and that is simply not the case for lots of different reasons as people age and as different conditions occur. So on your screen here, you can see different rates in percentages of how many people who fall into these categories have bacteria present during any sort of culture of their urine. You can see it's pretty surprisingly high, particularly when you start looking at women and men in some cases living in long-term care, residents typically over the age of 70. Depending on the literature source you use, 25 to 50% of those women are just normally colonized with bacteria. 15 to 50% of men are. If you start looking at comorbid conditions, so things like diabetes, bladder spasticity, the presence of catheter, all of those things go up quite a bit. Your last category here, you can see patients with a short-term versus long-term indwelling catheter. And short-term, if you're doing intermittent catheterization, 3 to 5% of people will have bacteria present on the day the catheter is present. If that catheter remains longer than 30 days, 100% of those patients will have bacteria present. So you can just really see how this can balloon into an issue rather rapidly. And when we have bacteria present in an older body where lots of things are going on, we can start seeing things like odorous, cloudy, discolored urine. If we reflex culture, we'll see that, yes, usually E. coli or something like that is growing. And if we do any sort of therapy follow-up, we can see that therapy tends to fail in that these things will still be present following the normal course of an antibiotic. Usually when we're treating UTI, we're going to do 3 to 7 days, depending on the complexity of the patient and what's going on with them for treatment. And if we are trying to treat this asymptomatic bacteria, 100% of the time, we're not going to help those patients. And about 30% of the time, we can cause harm to them in something that is just a normal part of the body and aging. Next slide, please. So we need good recommendations for what happens in that. There is just a laundry list of good recommendations in the Choosing Wisely campaign, particularly around when we should or should not culture urine, and also like when we need to just do empiric therapy. The bottom line is, if your patient is symptomatic, treat, culture, all of those things. If they are not symptomatic, don't treat. And so if your patient is febrile, if they're having flank pain, if they're having pelvic floor pain, if they're having noticeable urinary frequency or incontinence in a patient where that is not normally present, if they have confusion, plus they have leukocytosis, so we're seeing white blood cells in the urine, those are all indications that we should go ahead and treat. But it's important to know that like confusion alone or the presence of microbes alone, that's not symptomatic. We should not treat those things with antibiotics. If your patient is having delirium, increased confusion, new onset of confusion, we need to dig deeper. Like I said, the data shows no benefit from those antibiotics. Probably there's something else going on with that resident, and so we need to be prepared to dig into that. And when we'd had some previous conversations with our nursing home group, all of you said, yeah, that's great. We know this because you're great clinicians, but patients and families don't know this, and they're pushing for this urine analysis. They want the antibiotic, they want treatment. And so on our next slide here, we can talk about some resources. When I started really looking for patient and family resources around asymptomatic bacteriuria and when is a UTI symptomatic versus when there are no symptoms, there are very few good tools out there for you to use. I pulled this communication strategy from a communication toolkit from the Centers for Disease Control and Prevention. And this communication strategy they talk about is helpful, but if you happen to look at their example, it's full of medical jargon. Please don't do that. We have to be able to have a good conversation. And a lot of times they do show that it's best if people can leave with something. So a statistic on what's going on, why we're not treating their loved one with antibiotics, why we're not doing a culture. We're going to be doing some homework at Mountain Pacific to see if we can develop some of those tools with our Patient and Family Advisory Council, because most of the antibiotic stewardship information around not using antibiotics is really geared for when someone has a viral infection and leans hard on we only use antibiotics to treat bacteria, which is a poor fit when you're talking about asymptomatic bacteriuria, because bacteria is present. Of course, like they have bacteria, we should treat with an antibiotic. And we know that's not the case. So Mountain Pacific is going to do some more homework to work on that. But in the meantime, there's this 4-part communication strategy that can be really helpful. Being very clear with the findings, like, yes, we agree, your loved one had this fall, or they're having confusion, or I agree, their urine smells foul. However, we're not seeing the flank pain. They're not febrile. They're not meeting SIRS criteria. We're not having, hypotension, leukocytosis, no tenderness. All of those things tell us probably they don't have an infectious process going on. And so we're not going to treat because there's no infection. You provide that first clear negative. I'm not seeing, they don't have a fever. They don't have flank pain. We don't notice a change in their activity. And then that positive treatment recommendation for that foul urine, we're going to make sure we're monitoring their hydration status. We're going to monitor their nutrition. we're going to keep a close eye on their vitals for X number of days. And if we see any sort of change, here's our plan for what we'll do next. How you'll notify family, when you'll pull in a physician or other provider that's seeing that patient, really helping that family know, like, we take this seriously, and also, like, this is how we're providing effective treatment right now. So that can be really helpful. And then if we can go to the next slide, there are some other resources available to you that will be included in this slide deck, where you can go through and look at what are the guidelines for diagnosis and treatment, both for asymptomatic bacteria and also complicated and uncomplicated urinary tract infections. Be sure to look at your local recommendations for that empiric therapy, because E. coli resistance is very community dependent. And so you'll want to know what's best and recommended for your specific area. But otherwise, there is a whole suite of resources on there. And then Mountain Pacific is going to be doing our homework as well, so that we can better support you to have things at your fingertips to help facilitate those good conversations with patients and families. To that end, we also are going to throw in one more polling question today, just asking the audience about what else you might have on the top of your list that you need around antibiotic stewardship. We're curious what your highest interest would be for next steps, whether that's regulatory aspects of medication stewardship, the nuts and bolts of an antibiotic stewardship program, medication harm reduction, prevention of healthcare acquired infections, or anything else. Please go ahead and put that in chat for us.
Thank you, Stevie. It looks like we'll give folks a few moments to enter in their results. We're getting some great participation in our polling today, so thank you, everybody.
Thanks for having me on, Jesse, and I hope everyone hangs on, because up next is Liam, my wonderful colleague, who's going to talk about COVID-19 tracking.
Thank you. I appreciate that introduction, Stevie. Jesse, let me know whenever ready for me to go.
Yeah, we'll go ahead and close out that polling and stop sharing. It does look like most folks are interested in the nuts and bolts of an antibiotic stewardship program. So that's great. This helps us and see how we can align tools for you guys. So we'll close that out, and you have the floor, Liam. Thank you so much.
Awesome. So about a month or a month and a half ago, we presented this dashboard, and it's worth a shot meeting. So it may be slightly familiar for some of you, but what's really great is we've developed this COVID tracking dashboard to allow facilities to track their individual COVID story. It is a dashboard that's designed, not to be shared necessarily outside the organization, but really just tell the story about what's going on inside your nursing home. And so if I could share the screen, I'll give a quick demo about how it works, where to download it, and everything like that. So if you can see my screen here, we are at the Mountain Pacific Quality Health Foundation's website. And so if you access this website, you can download the COVID tool by going to Quality Improvements Tools and Resources, Nursing Home QI, and then going to COVID-19. And then there's two different options under this data tracking tool and dashboard. There's a fillable PDF that you can download, as well as the data tracking tool, which is an Excel file that is kind of designed in a way to be able to track your COVID journey. So we'll go into the Access Data tool. You can fill out your information here, and it'll allow you to download this file right here. There is kind of a little bit of a security precaution that Microsoft takes. And so we do need to enable what is called a macro for this to work properly. And so how you can do that, I'll show you. And then if you do have questions on this, clicking this learn more will guide you to the Microsoft website and give you a nice, easy step-by-step way of doing it. But I'll give you a little demo right now. So how you are going to enable these macros is by going to the file that you just downloaded. So this is the file that I just downloaded. Going to properties, and then you'll have a pop-up come up like this. And so under the security section, they had this file came from another computer and might be blocked to help protect this computer. You can unblock that, click apply, and then okay. Now this file is saved into your downloads right now. So what you want to do, so you can access it kind of countlessly, is save it to maybe another location that's a little easier for your computer. So in this case, I will save it onto my desktop and then to my computer. Sometimes it automatically will register that this file is unprotected now. But sometimes it doesn't. In this case, it hasn't. So I'm actually going to exit out of this file, go back to the file, open it back up. And as you can see now, that red thing is gone. So I can click enable content. So now that your file is set up to be able to use on your computer, now is really kind of the fun part, and you are able to enter your information, kind of tell your COVID journey. So we'll start off on how you enter your information. So you start off by clicking this launch form, and this form, as you can see on the screen, will pop up. You can do this at kind of whatever cadence you'd like. Either weekly, monthly, however you'd like, and it will kind of track that information within that cadence. So let's pretend we're doing it weekly. So let's go last week's information. We want to enter. Let's say we have 100 residents in our facility. Out of those 100 residents, 90 have completed their first series complete vaccine. Only 85 have gotten a first booster, and let's say 50 have gotten the bivalent booster. Now you'll go down and you'll enter the amount of unvaccinated residents with COVID-19. Let's say we had 1, and then there was nobody that was unvaccinated that passed away, nobody that was hospitalized, and then there were 2 vaccinated residents that had COVID. And so you can kind of follow the same format for vaccinated residents on the left side, and then your healthcare workers or healthcare professionals on the right side. So I'll kind of quickly go through these because we are a little limited on time. So you have 20. Okay, so we did last week's, and now to submit results, you click the submit button, and then do you want to submit results? Yes. It'll pop up with kind of a blank sheet again. If that's all the data you want to enter, you can press exit, but just so we can see some of the graphs in action, I'm going to add today's information as well. Okay, so now that we have our FINK information in there, we can start to see some of the tools. So this button right here will allow you to kind of see a spreadsheet of how your facility is doing. It gives all of the columns that we just looked at in that entry form in kind of the Excel format that they have. The other options that we have here are some dashboards that you can look at and some information that compares your vaccination rates to the CDC US rates. So let's first look at this dashboard button. So this COVID dashboard lets you know the COVID cases within your facility. So it's broken down into unvaccinated residents, vaccinated residents, unvaccinated staff, and vaccinated staff. And as you can see here, if it's this is indicating that on 12/7/2022, there was one unvaccinated resident with a positive COVID case. If there's a orange, that means that one vaccinated or unvaccinated residents passed away. And then also the gray is going to be unvaccinated residents hospitalized. That same kind of format follows throughout this whole tracking sheet. It goes date by date, as you can see. And it'll have kind of grouped bar graphs together by the date. This allows you to kind of see how you've been doing with your COVID cases and residents related to COVID throughout time, and kind of gives you an idea of, oh, okay, maybe this was a hard month, or this was a month that we were showing improvement, and possibly could lead you to some improvements or things within the facility. The other dashboard that we have is more oriented towards vaccines. And that dashboard can be found by clicking on this option right here. Another important part of this is if the graphs kind of look a little funky or anything like that, pressing this refresh all will help update those graphs. So as you can see, we've had those graphs updated now. So what this graph does, and it seems like these are having a little bit of a hard time loading, and I think it's because of the sparseness of the data, is on the left side here gives you information about your personal facility. So it gives you the percentage of vaccinated residents, the percentage of residents with a first booster, a percentage of residents with a bivalent booster, as well as some employee vaccination statistics. On the right side of this, you have the percentage of 65 and older population with a completed vaccine status, as well as the booster status. And then it's the bivalent as well, which is just starting to creep up as well. They also have US complete vaccination status, and then US for all US residents, their booster status. So this can give you a little bit of an idea about how your facility is comparing to the overall nation, whether it's the 65 and older population or the all US resident population. The last part of this, which I'll quickly go through, is that there is a COVID infographic that is included with this dashboard. As I showed you earlier, you can download the COVID infographic just by using this access fillable graphic, and that will download just the PDF version. There also is a version though embedded in the Excel file. This will automatically update with all these different tidbits of information. At the last the data of the last unvaccinated resident that was hospitalized, as well as vaccinated residents information as well. This can be printed out, put on a poster board or something within your facility, and kind of be able to show off or show the story about your nursing home and how they're doing with COVID. So that's the resource that we have developed for you guys. And I think that it will really help illuminate the COVID story within your individual nursing home.
Thank you, Liam. Is there any questions for Liam? Well, thank you both. I think the infographic is wonderful. I like the ability to put in your own personalized information and potentially post that and share that out. So thank you, everyone. Same time, same place next week. And I hope everyone has a good afternoon wherever you are in the country, and stay safe. Thank you, everyone.
Thank you.